to the Thyroid Stimulating Podcast. This podcast was created in partnership with the American Thyroid Association to discuss up-to-date diagnosis and management of a wide array of thyroid diseases. Today, we're diving deep into the topic that's rapidly evolving in the world of medicine, the use of media by physicians for patient and physician education. In this digital age, where information is just a click away, physicians are increasingly leveraging various media platforms to stay informed, educate their patients, and enhance their own knowledge. From social media platforms such as X and Instagram to podcasts, webinars, and even interactive apps, the ways in which doctors assess and share information has expanded tremendously. But with this wealth of information also comes a responsibility to ensure accuracy, relevance, and ethics in disseminating the medical knowledge. In this episode, we'll explore the multifaceted role of media in modern healthcare. We'll hear from an expert in the field, Dr. Malini Gupta, the founder of G2 Endo, as our guest. She earned her Bachelor's of Arts and Science degrees from Washington University in St. Louis, and then embarked on a global medical education at the University College Cork School of Medicine in Cork, Ireland. She then went on to complete her residency in internal medicine, followed by a fellowship in endocrinology at University of Tennessee Health Science Center. In the summer of 2020, during the height of the pandemic, she pursued a certificate in media and medicine at Harvard Medical School. She not only excels in her private practice, but also actively contributes to the medical community in various capacities. She is an active member in the American Thyroid Association, where she sits on the Social Media, Internet, and Communications Committee. She's also a national speaker and writer on various endocrine topics, sharing her knowledge and insight with a broader audience. She recently spoke at our annual American Thyroid Association meeting in September 2023 on the use of Instagram for thyroidologists. In addition to her impressive medical accomplishments and community involvement, Dr. Gupta has found a unique and creative way to promote awareness about endocrinology diseases. Her innovative approach combines her medical knowledge with artistic expression to raise awareness and educate the public. Her use of art not only engages audiences on a visual level, but provides a unique perspective on these often intricate medical conditions. With such a rich and diverse background, Dr. Gupta brings a wealth of experience and expertise to our discussion today, where we will explore the dynamic role of media in the world of medicine.
Thank you, Dr. Desai, for that wonderful introduction.
Okay. Thank you for joining me today to discuss the challenges, opportunities, and the risks and rewards and how these technologies are shaping the future of medical practice. So I wanted to start with, what are some of the key benefits of utilizing these various forms of media and medical communication, both from a healthcare professional perspective and for the patients?
Dr. Desai, as we know, social media is playing a larger and growing role in healthcare by facilitating communication, education, patient care, and the promotion of new ideas. It can help share information, tips, and news to a wider audience. It can help patients navigate complex disease states. It can help healthcare providers from different fields foster better relationships and communication. And now it's a global platform that can bring different people from different states of their medical education and experience to come together to come up with new ways to help patients.
Thank you so much, Dr. Gupta. Guys, kind of the flip of that, what are some of the common misconceptions or pitfalls that healthcare providers should be aware of when using social media to communicate?
Well, many misconceptions that healthcare providers have had include that social media is pointless. When we have search engines, there's no two similar media channels. They're all thriving to different communities of dedicated audiences. A lot of healthcare professionals believe that social media is only for younger people. No age group or generation now is excluded from using social media. It has billions of daily active users. All the platforms are different. A healthcare provider should be choosing their channels with care, considering their content and delivering their content to different audiences.
So with that, I think some of the concerns that people might have, especially maybe some of the older generation that's not necessarily using social media frequently. How can you maintain privacy and confidentiality when you're engaging with patients and the public?
I think you have to have a lot of awareness on what you're posting. I would definitely avoid sharing photos or videos of patients without explicit consent. Every physician should have a social media policy in their practice and make sure that patients are aware that they know what they're signing with that policy. I would never post videos or photos that have patients' faces, the hospital room numbers, the position of any identifiers such as their name or wristband, and make sure that there are no screenshots of medical records. I would definitely not give enough details about that patient so that someone might identify it. And of course, always make sure that no tattoo is in any photo.
So, thank you for sharing those recommendations. Do you engage with patients on social media? And what do you suggest are the best practices for engaging directly with patients?
Well, you should be very clear that no medical care should be given through social media and that a patient should seek help from a healthcare provider. I think that it's really important to make sure that you have boundaries set and when you're using social media so that patients aren't using social media to ask you for medication refills or to find out when their appointment is, and so they know how to reach you and what the best way is to reach you.
I know you engage in multiple platforms, X, Instagram, podcasting. Is there certain platforms that you prefer or you think work better for patient communications or work better for patient or physician education?
I do. I think everyone has their own preferences. Since I'm an artist, I have a lot of interest in visual media to promote education. So when I'm using visual media, I tend to go more towards Instagram, which has more uh, of a audience that is looking at images and short videos. So I have used this platform the most out of all the platforms. And that's where the greatest bit of the greatest audience that I have is on Instagram. I think that X has emerged as a center that has been key to medical healthcare professionals because multiple healthcare providers and researchers are currently using that as their main platform. I also use Clubhouse, which has a different mode. It's actually audio, and so it's been nice to engage with other healthcare providers, especially doing journal club type discussions or discussions between two separate fields, because it can allow people to talk and communicate with each other while doing something else.
How would you feel your experience in using that has changed how you practice medicine?
One of the things that I've done on my platform is have a very wide audience. I know that the work that I'm doing in educating people about endocrinology and thyroidology is important. I have a number of my followers are not medical. The way that I think it has helped my own practice is that I have tried to understand that people don't learn the same way. Some people are more audio oriented, some people are more visual, some people like numbers. And so it's helped me understand what works better in educating patients.
When you're using those platforms, when you're educating your patients, do you ever get any sort of negativity or patient responses that are unexpected? And how do you handle those kind of comments? Because using social media, there can be a concern that you would get comments, especially on controversial topics.
Well, unfortunately, that is part of the negative aspect of using social media. You will have a lot more misinformation that's out on different channels, and especially in thyroid disease, we know that um, uh, uh, disease states like hypothyroidism. We have multiple uh, rampant bogus hypothyroid cures that are out on social media from people who are not healthcare providers. So you're going to get a lot of uh, people who may have read something that is incorrect and will argue. The best advice is to not engage with negative comments. And then if you do engage, you do state facts. You may help them try to find a better source. Sometimes patients or people using social media are still not receptive to evidence-based medicine, and you just have to sometimes block those people.
Thank you for sharing that, because that can be sometimes difficult, to set some boundaries for both you and other patients. So I think that's an important aspect of addressing how to use social media effectively. You had mentioned that you're reaching a larger population of patients. So one of the other avenues or aspects of this is that social media may be able to bridge the gap in certain healthcare disparities. So how do you feel like social media can be used to use information to reach underserved communities that may not have the traditional face-to-face with physicians or have the opportunity to get that time because of insurance issues, because of transportation issues, because of taking time off from work? With social media, you kind of have access to it 24/7 in a lot of different areas.
Well, I think that social media allows what we call a free open access movement that has changed medical education and resources for everyone. I think that uh, it can be used by both physicians and the general public to remove geographic and income barriers across the globe, so that you do have access to more information. It's been very interesting to see how over time we have more people being able to connect with other people from other countries. And language is no longer a barrier because you can hit a translation key and at least be able to read a translated excerpt of someone's post. So I think that it has fostered a lot of better relationships that extend over country borders.
So as it's making our world a smaller place, can you share some of examples of successful media campaigns or initiatives that have made a significant impact on public health awareness?
We're always trying to promote endocrinology and different aspects of medicine. And I think one account that has done particularly well with this belongs to Dr. Tanaya Narendra, who's known as Dr. Cuterus on Instagram. She is a practitioner in India who's used her platforms to increase sexual health awareness and maternal and infant health, including HPV vaccination. She has over 1.1 million followers now and has had the attention of the Gates Foundation. So I think she's making great strides in using social media to improve healthcare awareness. And I think she's a good leader to follow.
Well, thank you for sharing that. I wanted to kind of switch focus a little bit from, we spent a lot of time talking about how to engage patients and educate patients, but the other interesting aspect of social media is to use it for physician education. As you said earlier, we all learn through different avenues, either visually, audio, through reading, and social media through podcasts, through Instagram, through X provides different avenues of learning material. I find it very fascinating that most recently our different endocrine society and the American Thyroid Association have created social media committees to help stay up to date with these kind of topics. So can you share a little bit about what it's like to be on such a committee, things that you've done through the committee?
Yes, I've really enjoyed being on the American Thyroid Association Social Media, Internet, and Communications Committee. And part of our role is to increase the awareness of different thyroid topics, primarily through X, but we're using other platforms as well to increase engagement in the American Thyroid Association. So it has really helped using our different hashtags to find people who are interested and who are world leaders in thyroid and have them come together and help share information that's important and timely. Now we have access to global news on 24/7, and so that global outreach has been really important through some of these platforms.
Do you share, when you're using these platforms, do you share like research? Do you share your own patient outcomes? Do you share I know we talked a little bit about sharing patient cases and their guidelines for that. How, if someone was looking about starting up on social media, how would you suggest that they do that?
Well, I think that you have to know your audience and who you want to engage with. There's some people who have traditionally used social media for sharing family photos with their friends and events with their friends, may be intimidated to share themselves and their medical knowledge with other healthcare providers. So I think that it's really important to know your audience. We use Twitter a lot for sharing different publications that have come out and bringing attention to the publication or the key facts about that piece. We also use it during our meetings so that people are aware of what's going on in our meetings. We highlight different members to make sure that they're getting recognition for what the work that they've done. I think that when you're trying to set up your own social media, you have to find what makes you different and what makes your content different and shareable. And that's key to social media, is that shareability. How are you going to post something that is worthy enough to be shared across that platform?
So what I'm hearing you say is almost some of the terms that people might use is branding yourself. Is that kind of similar to creating a brand?
Yes, definitely. I think you should be as an individual as you possibly can. There are some pitfalls that people do make when they're joining some social medias and thinking that they're only going to be successful with a certain number of followers, and then they fall into uh, problems with maybe buying followers. I would suggest never buying followers because that can damage public trust. You want to be as genuine and engaging as possible, and try to create content that you would want to see.
And when you're doing that, what kind of resources or tools do healthcare providers have in creating that, getting that skill set? I know you got a media and medicine certificate. Can you share a little bit about what that's like? What was that that was like?
Yes, I was in the inaugural class of the Harvard Medical School Media Medicine course that took place right before the pandemic, and it allowed me to really try to understand how we use visual and other forms of storytelling to improve healthcare awareness and disease state awareness. It really uh, I used it in conjunction with my degree in creative writing and English from Washington University to bring what I do in the literary world with medicine in some of the projects that I did, um, and I use it to develop better relationships, to write op-eds, to write essays. Uh, Someone can do one of these programs. Their healthcare communication science is actually a growing field. I think that uh, this is going to be larger as time goes on because more people will study healthcare communication and science, and this is going to change how we design our different programs and work together with communication programs.
Great, thank you. Dr. Gupta, are there any specific guidelines that are currently available to consider that doctors should consider when sharing medical content on platforms such as X and YouTube and TikTok?
Absolutely. The American Medical Association has a code of medical ethics that is very specific to social media and social networking. Physicians should understand patient privacy and confidentiality should be maintained in all the environments, including online environments. And they really should refrain from posting identifiable patient information online. When they're using social media for educational purposes or exchanging information professionally with other physicians, they should also follow the ethics guidance regarding confidentiality, privacy, and informed consent. They should use privacy settings to safeguard personal information for themselves and for their patients. And they should watch their own internet presence to make sure that their personal and professional information is accurate and appropriate. I think that if patients are interacting with physicians on the internet, they may also suggest that physicians maintain appropriate boundaries of a patient-physician relationship in accordance to professional ethics guidance, just that they would in any other context. And then make sure that they're appearing in a professional manner when they are presenting themselves on social media, because it can result in violation of professional actions. And I think that physicians have a responsibility to make sure that their actions online can impact their reputations negatively.
Dr. Gupta, can you share with us how you got into social media use and creating your brand?
I got started in social media by using platforms like Facebook, where I was able to become part of a larger community of endocrinologists, and that helped me understand that we do have platforms that have different communities. We developed a community of endocrinologists who can discuss different cases that are blinded and help each other professionally. I started my own Instagram account, recognizing that there was a need for education in a different way. I use food to create anatomy and different physiology images so that it's non-threatening for people to see that. And so I use food as the medium in my pieces. And I think that's very unusual and has really been instrumental in how the page has been doing.
So you initially started on Facebook and with a group of a larger endocrinologist, and then you transitioned to using Instagram more. Comparatively to Facebook and X, Instagram is a more visual platform. Can you share a little bit about how visual storytelling through those two platforms such as Instagram or Snapchat play a role in educating the public about medical conditions?
Visual storytelling uses graphics and images, videos to help hook in the audience and then drive storylines and emotions and education. I think that it's part of telling a story or communicating information using visual content, and it is extremely powerful because it can relay a lot of information in a very short period of time. It has the potential to generate a lot more traffic to a site or increase shareability because people are attracted to visually interesting things.
Social media has a significant impact on healthcare in today's digital world. Dr. Gupta, thank you again for joining us to talk about the use of social media in medicine. If there are three top things that you would recommend for someone who's new and starting to social media from this talk, what would they be?
Thank you so much, Dr. Desai, for having me today. I would definitely say that one, I would create content that you would want to see yourself. Two, make sure you interact with healthcare providers from other countries and use it to collaborate with healthcare providers from even other specialties so that you're learning as you're also sharing. And only share what you think is authentic information, but remember that you are an authority in your field and you can make a difference.
Thank you again for joining us for today's episode of the American Stimulating Podcast, hosted by the American Thyroid Association.